We start, though, in Massachusetts with Lindsay Clancy's triple murder trial. Her defense team just wrapping up its case today ahead of closing arguments slated for next week. Now, earlier today, defense attorney Kevin Reddington calling to the stand a psychiatry professor who testified that several tests done on Lindsay Clancy after her children's deaths indicated, quote, no evidence that she was faking psychiatric symptoms. He also reinforced prior testimony about the voices Clancy had been hearing at the time of the killings. Yesterday, a hospital chaplain who met with Clancy weekly since the murders testified about her audible hallucinations. She said during their conversations, Clancy had told her about a, quote, persistent male voice.
The voice, according to Lindsay, told her that if she did not follow the command, neither she nor her children would be safe.
NBC News correspondent Stephen Romo joining us now alongside NBC News legal analyst Misty Marris. We appreciate both of you being here. So, Stephen, let's start with you. Today's witness here, this psychiatrist expert met with Clancy for several hours. This is after the murders, right? And so he seems to be that he is sort of lending credence to the idea that there really were hallucinations that she was reporting. What else did we learn today?
Yeah, a strong witness for the defense. Dr. Philip Resnick also testified in the Andrea Yates case back in 2001 in Houston for a similar case, and went through the defense questions and spoke very firmly about this command hallucination, this voice that Lindsay reportedly heard. And he went further, saying that she felt her body was being taken over by someone else, and she was not the one pulling the string. Some very strong statements there. Here's more of what he had to say on the stand.
At the time of the crime itself, on January 24, 2023, Ms. Clancy was frankly psychotic. So in that sense, she had a postpartum psychosis.
Now, prosecutors pushing back on this, of course. He brought up the Andrea Yates case. So prosecutors in their cross mentioning that Andrea Yates put herself in the hospital 5 times and attempted suicide twice before harming her children, before killing her children. And it seems like in Lindsay's case, it was not the same.
It's interesting as well, Misty, because this Mr. Resnick here had also been working as a consultant on some other really high-profile cases, including Jeffrey Dahmer, Casey Anthony. What did his testimony today, how important was it, I guess, for Clancy's claim of postpartum psychosis? How much did he illuminate that?
Yeah, so he gets tapped in for a lot of high-profile cases. He's very, very well known. So what he did was talk about one of the prosecution's arguments, which was that Lindsay Clancy wasn't acting like somebody who was going through the symptoms she was reporting. So was she faking them? Was she exaggerating them to cover up for her intent to kill? He says no by review of the records and his meetings with Lindsay, and also speaking to what her mindset is on that day. So one thing that's going to need to happen, and is happening right now and will happen when the jury gets its instructions, is separating the medical diagnosis from mental illness from the legal standard of did she know what she was doing was wrong and could she control herself? And that's what this doctor is saying, that she was in a state of psychosis on that day. What I do think was interesting on cross, that the prosecution was able to poke a hole and say, well, is it usual somebody 8 months after delivering a baby would be in a state of psychosis? To Stephen's point, well, the first time she heard a voice, she acted. That's unusual, right? According to one of your most high-profile cases, Andrea Yates. So a little headway there in the prosecution. This is what we call the battle of the experts. Very typical to see this play out.
The battle of the experts, which also included, by the way, the hospital chaplain. How did her testimony recently also weigh into this general conversation?
So prosecutors had said that the first time voices ever came up was when Lindsay Clancy was with an expert for the defense on February 4th. But their timeline was disrupted by the chaplain's testimony that she actually spoke to Lindsay, and Lindsay mentioned the voices on January 31st. So it's a really credible witness who said that these voices had come up previously, not implanted by a defense expert. Meanwhile, Sam, one thing I think prosecution went really hard on her on cross, kind of saying she's a liar. That's a tough argument to make.
I would also add, by the way, just the overall atmosphere around this, Stephen, real quickly, what kind of support has Lindsay Clancy been seeing both outside of the courthouse and on social media?
Yeah, this has really struck a chord. There was a big rally yesterday, a silent rally in support of Lindsay and also for maternal mental health care. And just online, I've seen so many people messaging me, talking about their strong feelings about this case. Many people think postpartum care is not where it should be in this country. Many people think mental health care in general is not where it needs to be in this country. and they're really seeing that in this case.
It's a terrible tragedy that seems to have resonated with people for a variety of reasons around the country. We know you two both are going to be continuing to cover it. Stephen and Misty, thank you so much.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.